understanding. The parent doesn't realize what the school requires and what the limitations for the nurse are. And sometimes the nurses get frustrated because they see a child that's coming in whose blood sugar is high often. So what we need to try to figure out is, why is this blood sugar high? What are the problems? What do we need to change? Sorry, Nancy, I just remembered. But anyway, so what we try to do is work it out so that we're all on the same page, and because we all want the same thing. We want the child to have a happy, normal school experience. And we certainly don't want them to be singled out. For our part, we also want to make sure that they're getting enough insulin in the right doses. So we may not know that they're having, that they might start out with normal blood sugars in the morning and have very high or very low blood sugars before lunch. So what we would hope is that you communicate that with the parent, so the parent knows, send them those forms. And if the parent is okay with it, fax them to us. We can look at them and make suggestions to them about making changes in the dose. But as long as we're all communicating, that's the most important thing. A lot of schools prefer insulin pens because it's easier. The nurse can, sometimes it's not just the one child in there. They have many kids in the clinic before lunch. The pens are easy because if you know what I'm talking about with insulin pens, you dial up the dose, you can see the number, do the air shot, give it to that, and you've got the dose, and it's easy to give. Much easier to supervise than the whole pulling up and that. We're having some challenges with insurance coverage these days. So for the school nurses, I would want you to know that sometimes parents are bringing in vials and syringes. I've had several of my patients, some insurances are not covering pens, or the copay is so much higher for pens that they just can't afford it. These are kind of tough times. So if you see, and I say that because I think it was last year, one of the counties, I try to go to the nurse training days for the different counties that we serve to try to talk to them so they understand the issues, which that's what I want to talk to you about because I haven't. But anyway, so they were saying that the schools, they had to send a pen to school, and I was getting calls from the parent, but my insurance won't cover it. So if you're seeing that, you can ask the parent about it, but sometimes that's the reason the copays are getting much higher, and some insurance are just refusing altogether.